Disability Rights Arizona presents Arizona Long-Term Care System. This video will discuss the Arizona Long-Term Care System, or ALTCS, and how people with traumatic brain injuries and others may qualify for long-term care services. ALTCS is Arizona's Medicaid program for individuals who have physical, age-related, or developmental disabilities and require long-term care services. To qualify for ALTCS, individuals must be an Arizona resident and pass two main assessments, financial and medical. The application for ALTCS can be completed by going to the nearest ALTCS office or calling ALTCS at 888-621-6880. Once the application is submitted, a social worker will contact you for a financial assessment. After the financial assessment is completed, you will be contacted for the medical assessment. The entire ALTCS application process takes around 45 to 60 days to complete. Information about the ALTCS financial assessment can be found on the Arizona Healthcare Cost Containment System website at azahcccs.gov. The medical assessment for ALTCS eligibility, called the pre-admission screening, or PASS, is done by an assessor after financial eligibility is determined. The PASS assessor will ask the person or their representative a series of questions, and by the end of the assessment, the PASS assessor will provide a final score which is used to determine medical eligibility for ALTCS. These are some tips to keep in mind for the PASS assessor. Give full answers to the questions and be detailed about your day-to-day activities. Inform the assessor what you can and cannot do on your own. Do not exaggerate your abilities. If you have some days that are better than others, focus on what help you need on your difficult days. Explain why you need help with tasks and what is needed. Tell the assessor how long it takes for you to do daily living tasks. For example, how long it takes to bathe or dress, and what type of help you need to complete this task. Remember to have all your medical records ready. Be sure to include recent medical records related to your need for long-term care. It can be helpful to have a letter from your doctor that explains why you need long-term care and how it would benefit you. Medical documentation should also have all your diagnoses and medical conditions. If you move to Arizona from another state, share any documentation showing you had long-term care services in another state. If you are told that the assessment will be done via phone, you can request an in-person assessment as an accommodation. The in-person assessment may allow the PASS assessor to better view your functional limitations firsthand and to understand the full extent of your functional limitations. ALTCS approval. If you are approved for ALTCS, you will receive a letter of approval. You will be assigned an ALTCS case manager and can choose a provider agency for your care. ALTCS covered services may include home and community-based services, medical services, facility-based care such as a skilled nursing facility, behavioral health services, hospice services, and preventive and well care for children. Once an agency is chosen, you can interview providers that fit your needs. It is important to ask the provider about their experience. Explain to the provider what your needs are and what task you need them to perform. ALTCS denial. If you are denied ALTCS services due to not meeting medical or financial eligibility, you can appeal the denial verbally or in writing. Written appeals are recommended so you have a record of the appeal. Pay attention to the deadlines in your denial letter. Appeals must be filed within 60 days. You can also reapply for ALTCS after being denied. You should carefully review the denial notice to understand why you were denied. You may need to gather additional documentation, correct errors, or provide further information to be found eligible. Veterans with TBI. Veterans with traumatic brain injuries, or TBI, also have other options for care. If a veteran with TBI applies for ALTCS and is denied, they can reach out to Veteran Affairs or the VA for assistance. When contacting the VA, make sure that you have your DD-214 on hand. With VA services, a veteran is assigned a social worker that can work with them to identify needs for assistance with daily tasks and possibly arrange caregiving assistance in the home. The VA also offers different treatment plans and therapies for veterans with TBI. Contact the local VA either online at www.va.gov or call 1-800-698-2411. To access more information about your healthcare rights, visit Disability Rights Arizona's website at disabilityrightsaz.org or call 602-274-6287. The information presented is intended to be used for informational purposes only and is not legal advice. If you have specific questions or want legal advice, please contact a qualified attorney in your state.